I'd like to welcome everyone to this COVID-19 community meeting. And one thing we do with the city, we always start with the Pledge of Allegiance, if that's fine with everyone. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you for coming today. I was hoping to have a larger group here, but after all the data came out, we realized we were getting too big already, so there are some businesses that will be meeting in this same format tomorrow, like the grocery store, the drugstore, the financial institutions. We're hoping to get their operational changes out to everybody here and also have them hear how your changes are, because we're all one community and it's just nice to know what's happening and everyone else know what the rest of the community is doing. So that was the whole purpose of that, was the sharing of information, and see how that goes. And with that, I'm going to turn it over to Katie, the city administrator.
So my name is Katie. Thank you all for coming on such short notice. I truly do appreciate it. For the city, if you guys haven't seen or heard, we are shutting down our community center to visitors, to the public. The AEOA is probably the most affected by this, seeing as they can't host the senior dining Monday through Friday like they usually do. They will be doing the delivery meals. So I would suggest if you or anybody is interested in those meals, contact them, and I'm sure they would appreciate some extra drivers. Our liquor store is closed until the 27th as of now. That may change. That's just the bar. The off sale will be open from 10 a.m. until 8 p.m. The police department will be functioning as normal. I'm trying to think what other, the recycling center we just kind of thought of, and that will be closed until further notice. DMV will be closed. Basically the only function out of this building is going to be AEOA, and that's only for delivery. And then also I will be here for administration. So if you guys have any questions, need to call me, email me, whatever, I will be here. The other functions that are available are police department as well as our public works department. They are still on staff as of now.
And the police will stay fully staffed throughout this whole period, as mandated by the state. We're not going to cut any hours or cut any positions. They'll be available. You did mention the library.
Yes, the library, yep, is closed also. So basically this community center is closed to the public aside for meetings such as this that we specifically invite a few people to, and we want to set it up so everyone feels safe and distant.
Any questions about the city? Yes.
Do you have an end date for this, or is this ongoing until?
Well, the mandate for the government was for 15 days, so we're going to that whole 15 days and reevaluate. We're hoping the state will come out. We're looking at that daily to see if any changes or more info, but I'm sure it will come out before that 15th day comes.
As a staff, we're meeting each day with the Public Works Department, Police Department, our electric utility. The mayor and myself are meeting daily to discuss any changes that happen. It seems like things happen pretty rapidly. So we're going to meet daily up until a point where we can meet every other day and then space it out from there. But yeah.
We're meeting at 9 o'clock right here every morning. So if you have any information, please get it to Katie before then if you wanted to share it with the city for any reason. Other than that, anything else? Thank you.
Yeah, does anybody else have any other questions as far as the city goes?
Do you foresee these meetings to continue?
That was something that, yes, thank you for bringing that up. Something that I wanted to gauge with all of you, whether you wanted to continue to do these meetings. if you feel that they're useful, I will absolutely continue to do them. It might be kind of nice if things change pretty rapidly, to just keep them on the books.
That was kind of something we were gonna ask at the end, after everybody shared, if they see a value in it. And something for everyone to think about, and we'll ask that at the end of the meeting.
I mean, I certainly don't want to take up your guys' time if you feel that these meetings are not as valuable as we thought. But if they are valuable, I'm more than willing to continue to do them.
Why don't you ask at the end, see how
Yeah.
it goes?
Sure.
You bet. Oh, Mr. Indahar.
Yeah, the school, as of Sunday, we were required to shut down starting today. So we had school Monday and Tuesday, and today through the 27th is a period where we are planning for distance learning. There's nothing else going on besides that. We do, while in the school, we were doing all the things that CDC required. You know, right now we've got it so that we're not having meetings of more than 10 people. The washing of the hands, all after-school activities are canceled. Sports are canceled till I think like April 6th at a minimum. And so for these 8 days, the teachers are planning for distance learning. And then on the 30th, that's when probably distance learning will be happening, and there's no indication we're going back to school. So we are just preparing. We're preparing for, up to the rest of the year being just distance learning, which is something very different in the schools. Right now, the thing that I really want to talk to you about is the state has also required us to provide meals to all children under the age of 18. And as of tomorrow, we are going to be delivering it to the homes. So any child who's in our district, we are going to be, you have a choice to get curbside pickup at the school, or we will simply deliver it to your house. So we will be delivering a breakfast and a lunch, okay? So that's kind of and it's free, by the way. So all, citizens should probably take advantage of it. It's
Is
through
that all children?
yeah, any child who's less than 18. So it's through a federal program. It's free to us. So take advantage of it. The other thing I wanted to let you know is that we are required to provide child care for emergency workers. If you go down the list, it's every group that we have in this community. And so, I don't know if you guys got the list, but there's a whole list. It's got specific jobs that qualify. But what you qualify for is free child care if it's for school-age children, so kindergarten through 12th grade, and it's during the school day. Now, we have always provided child care, or you can, pay for child care. Mini Moose is the really young kids, 3 and 4, and sometimes 5-year-olds. And we also had before and after school care that you could, it's school age care. This is talking specifically about children who are in grades kindergarten through 12, well, it's actually probably through 6th grade. It's up to age 12. That if you need child care and it's a hardship for you, that you can get it for free through the school. And so they just need to let us know. And if they want to know whether they qualify or not, an easy way, and most of your places you have badges, have them take a picture of their badge so we know what their job title is, and then they can call in and talk to Kendra. Kendra has the list. And I'm sure they can go on the Department of Education website and get this too, just to see, does their job qualify? But most of your jobs qualify. So I think that's a pretty good deal for your employees. We are actually being a little bit liberal with this because we know some of your employees start before 8 o'clock. So just call and we think we can work things out with you. So those are 2 big things that we're doing at the school. And so far, we didn't have many people taking lunch yesterday. We probably had, or what was it today? do you think about this?
It was today.
Today, it started with about 11, but it ended up being about 60. So, you know, the rate of growth of the virus, you know, perhaps we would have, you know, 1,000 by the end of this week, but not really. But anyhow, the food and the meals and the childcare is a really good deal, and that's we're prepared to do that, you know, and we just need to know who's going to take advantage of that, and so. We've been trying to get the word out. You can get the word out as well. And if you need to know more information, just let me know. Billy Joe, what did I forget? Okay, that's what's happening at the school.
I'd like to get a copy of that to put on our, and transmit it on TV.
Okay.
I think it's on our website too. We have a tab that we started with all of our updates that
Yeah.
are related to the COVID-19. So every time we send a letter out to parents or new information, we put it there too. So that list should be there.
But I could give it to Katie.
So just one question on the meals. Do people like call in to order the meal, or is it just?
So
you make
it's
that
pretty
menu
simple.
for-
What you need to do is you need to give us permission to go out and give it to you. So all you have to do is email us and say, I have 3 children and here's my address, and I give you permission to drop off the meals at my house. And you will get and you have to email Sherry. It's on our website, so they have to do it to the right person, of course. But yeah, and if you're part of our district, just email Sherry Anderson, and we'll bring out a breakfast and a lunch for any student who's 18 years or under, or any child who's 18 years or under. Yeah, it's actually really sad in the school, probably sad in a lot of your places. What the heck, there's no kids in our building anymore. So I mean, we got really little kids, but yeah, it was kind of a sad day yesterday. We waved at the kids as they left on the bus, and a lot of tears. So, but it's you know, it's just a reality we have to adapt to, just like you guys. So.
Bob, is that delivery part on the last written statement that you have from the school, or?
Yeah, so we just sent it out today. We were trying to get that out today because we just changed that. We felt it was too restrictive to do curbside because I had only had 11 families and it was free food. And it's like, okay, something's not working here. So we're going to deliver it. And so it is on our website probably today, but it'll be on Facebook today, right?
It's on Facebook right now. It'll be on our website as soon as our webmaster updates it.
Oh, yeah. Yeah.
But an email and a voicemail went out to families.
Yeah, so our instant alert, it went out there, and then people have been calling pretty regularly today, so I think the word's getting out there, and as they call, we are just saying, you know, we are now, as of tomorrow, going to start delivering meals, so.
Yeah, your whole staff is working through this period.
Yeah, and that's part of the deal that we have, is that we have, our staff is, obviously the teachers are trying to put together distance learning, but I do have a lot of, like, I still have bus drivers, I still have paras, I have people who have jobs that when the kids aren't there, we need to find alternative jobs for them, and nobody, according to the governor, nobody loses pay. So that's why we're able to do this, and you know, we're a state institution and trying, you know, so most of you, so.
Any questions? Bob, anyone? Appreciate it, thank you very much.
Yeah.
Very good. Next we have Department of Corrections.
Good afternoon, everyone. Bill Bolin, Warden for Little River Moose Lake. I just want to express some gratitude towards Bob and the school district that myself and the employees and community members are very appreciative of the fact that access to food for our children and also the daycare. I know that's a big concern for a lot of our employees, and they've expressed that gratitude with that Governor Walz and the area school districts with fulfilling that. So first off, I want to let you know that Department of Corrections, we've been working closely with the MDH and CDC in reference to the pandemic. We are actively involved in planning central office has a command center set up and is working hand in hand with our incident management team to help assist in any type of programming and plans for facilities. Facility-wide across the department with our 10 facilities, each facility is under incident command and having CFOP sections, so we've got command, finance, logistics, and planning in place. And then on a daily basis, they're meeting to do some effective planning on a moving target, really. I know that I've been in 6 meetings again today in regards to our plans with this. So, with our facility specifically, today I believe we've got 1,065 offenders under our care and close to 400 employees. And so, again, the mindset for our agency and really for our facility is the safety of our employees and then also the safety and security of our offenders. We're kind of like a cruise ship out in the middle of the sea, so to speak. And our space is really limited when we talk about social distancing and things like that. But we've got some plans in place that are going to hopefully kind of prevent and then contain in the event that we have any outbreak. At this point, there is no confirmed COVID-19 cases within the department. But we do, again, maybe anticipate and really plan towards how we go about preventing and containing that. For our community members, especially last week, there was notice put out for visitors of our offender population and volunteers, because we've got a lot of volunteers that come into our facility to provide services. They were informed that we were closing that down through the 27th of March, and again, we're going to be reassessing whether we continue with that or do some adjustment to it. Also, along with that, all employees and contractors that are coming into the facility are going through a pre-screening. It's a self-reported questionnaire that basically asks if you've had some international travel within the last 30 days, identifying the 14 countries that have had high outbreak of COVID. And then the final 3 questions really are symptomology regarding the virus. And then based upon that, we're making decisions again based upon what MDH and CDC is telling us on how to respond to employees that may have some symptoms. So some individuals we've been asking to go home, contact the medical provider to get input. It could be a 3-day quarantine just to ensure that there's no fever and other symptoms that continue. But again, it's really a moving target in that realm. We've also implemented some hand washing stations at the entrance and throughout the facility. So we've got an active pursuit of informing staff and offenders and contractors that hand washing, covering coughs, limiting your space. If you are ill, seeking medical attention, again, all in the effort to prevent any type of spread. We have made some adjustments in our offender programming, and we're continuing to take a look at that to maybe reduce the number of offenders in group settings or classrooms. With regards to our Willow River CIP offender program, we pulled the restorative justice work crew out of the communities as a preventative measure. And again, we'll be accessing that in a week or so, depending on the pandemic spread and whatnot. There's a lot of planning around the arena of containment. We do have identified spaces within the facility if there was offenders that had an outbreak with that, and we've got plans in place on how we're going to address and contain them. A huge stress and workload placed on our health services staff, not only with the basic offender needs, but then with the possibility of virus spread. The other piece that kind of plays into this too is that we're moving into allergy season. We've still got the influenza season going on, so symptomology and reporting of that makes it difficult for those staff to really assess what's going on. So that group there, I know has their hands full, so to speak. We do have a daily reporting structure that's implemented across the department too, that's kind of tracking the number of individuals that may be exhibiting some symptoms, how it's had an impact on our staff call-ins, how it has had an impact on the financial aspect regarding supplies related to this. So we've gotten pretty detailed into collecting the data in regards to this particular pandemic. So let's see what else. And then the last thing that I'll really touch on is that we've had open communication with union. We've got some contractual areas in regards to our correctional officers that we're reviewing that hopefully will kind of open up some latitude with retracting some vacation requests, maybe the ability to have some extended shift exchanges, all in the spirit to really try to work with the staff in the family life arena as it relates to childcare and other activities. We want to try and be accommodating as possible, but in the same sense, we've got a job to do, and that is centered around public safety, and we just can't close up shop. We're 24/7 and we need to operate. So, but overall, I think, especially at Moose Lake and Willow River, staff have been very diligent, receptive, and understanding of the situation. And I've heard staff also say that they're very thankful that they've got a job based upon some other things that are going on in our communities and closures. So, so very appreciative of that. So that's all I've got. Any questions that you may have?
I've got one. I knew there you had some medical staff, but I guess I've never asked, like, do you have doctors or nurses?
So we have nurses that are on staff. We have contracted doctors that come in for dental and other reasons. We're not 24/7 in a sense, but we do have on-call. And again, after hours, we really rely on local services. Along with that, currently with our situation, we're really only going to be taking offenders off-site in emergent conditions. So really pulling back on medical appointments and really non-emergent type of things that have come up in the past, because we know it's very taxing on the health system. And we want to try and at least do what we can within the facility. So,
One other question, I think it's time for both you, because I just realized, I think a lot of our firemen do work at the facilities and in emergencies. You guys are kind of in an emergency situation. Are they going to be released to respond to community emergencies? Because your staffing probably is going to get tighter and tighter as we go into this. Has that been addressed at all, or?
It hasn't, and it poses a good question, because we do have a number of first responders.
I know we do.
Within the community, and if we get to a point where we're faced with staffing shortages and it comprises of makeup of local responders, that we need to talk about that and address that, yeah.
Yeah, okay, just another awareness item, I guess, for all of us. Anyone else have questions? Thank you very much, appreciate it. Mercy.
Hello, thanks for inviting me. My name is Mike Uso, Administration at Mercy. And you're going to hear a lot of the same themes from me that you've heard from the past three gentlemen. I will say, at least on the Mercy side of the healthcare equation, everything has really escalated, or the pace of change has changed dramatically since Saturday, Sunday. Since the governor made his announcement, and things have started to escalate. I'm just going to go through what decisions have been made at Mercy regarding shutting things down, and then just what we see as current issues, and and guessing what's going to happen next. I'm not going to go there, but we have canceled elective surgeries as of yesterday, and also it'll be physical therapy, imaging, potentially some lab, but basically anything elective that is not critical is being deferred. And to a large degree, it's being deferred because of supply shortages. I mean, you want to minimize people in the facility, but the supply potential shortage is a big concern across healthcare. We closed our gift shop. Volunteers have been sent home. We have one visitor per patient. We have the screening process in place. At the hospital, we currently have 2 entrances. We're considering going to 1 entrance. We have not yet. We're screening vendors. We're meeting Department of Health, Minnesota Hospital Association. Obviously, the CD is plugged into those 2. We also have the Northeast Regional Emergency Preparedness Coalition that's meeting regularly, and then Ascension St. Luke's, as of at 3 o'clock, have organized a regional meeting with the facilities, kind of Cloquet, Mercy, Rapids, Hibbing, and Luke's and Ascension, all around the same topic. So there's not a lack of information, and I would say one of the challenges is filtering through the information to what's pertinent for your facility. Probably number 1 on the list of concerns at Mercy is just supplies. N95 masks, gloves you mentioned. We're short on hand sanitizers and whatnot, and our vendors are not supplying it. I mean, we'll get it, but the supply thing is probably the number, I shouldn't say number 1, because supplies and labor would be our 2 top priorities. And labor, I'm referring to nurses and doctors. So right now, we don't have any influx of, corona or COVID, or, we have regular flu, so we're not being directly impacted yet. I don't think there's a confirmed case yet in Duluth. Is there? Have you heard anything? No. So I would say, we'll have it, and it will occur, and the question is to what degree. And across healthcare, again, I would say the concerns across the hospital side of healthcare are ICU beds, hospital beds, MDs and nurses, and with MDs and nurses, obviously, if they get sick, there won't be enough, because there's a labor shortage in general before the virus. We implemented Incident Command Monday, so we're meeting every day now, and we're communicating within the facility. We're working with Gateway and Augustana to try to be coordinated with those 2 organizations, and so far, again, we haven't had any impact. Our volumes have been fairly normal to a little bit below average, which I think is expected. There's less people coming into the hospital, and there's less people coming into most facilities right now, which is the whole idea. I probably have missed some things, but I'll pause. Does anybody have any questions?
I do just, which I probably should know, but I don't, how many beds do?
25.
25 beds. And like for critical, like you'd say like a real critical condition?
Well, if they're really critical, they're gonna be shipped to a tertiary.
Okay.
Yeah, and we're looking at, we're looking at ways where we can isolate influenza patients when they come in from other, what I would call routine ER patients,
Yeah.
you know, with space, because with the canceling of some procedures, we're freeing up some other space. But I mean, if they're, we don't keep patients on beds. You know, they would be going to Luke's or St. Mary's.
If you had to expand here locally beds, do you have the room and or supplies to do so?
You know,
Beds to do something like
we
that?
can't expand beyond our 25 beds, but again, I would not, my worry, Ted, if we were at that level, will we have the clinicians, you know, doctors and
Right.
nurses, you know, to be able to handle that volume?
Sure.
You know, and I think the answer would be yes, but again, I think it would be a stretch, and I could turn around and ask Dr. Camp if she agrees with me. But I think, don't you agree? I think it's,
Absolutely.
I think that, and again, that would be, you know, I've been asked, you know, I would say if we have an influx of volume, it's clinical resources as in MDs and nurses. And then again, that's assuming nobody gets sick.
Sure.
And we have folks that are sick, and I think another challenge, and I'm sure Gateway is seeing this, you know, it's you know, everybody thinks they have corona, you know, and it's, you know, the flu generally, and there aren't enough testing kits. So I think, you know, I think we're playing a little catch up here in Minnesota, but I think we're in good shape for the most part. And nobody can anticipate what's gonna happen.
Do we even have the capability to test for the COVID-19?
We do, you gotta ship it out though, and it takes a
Okay.
few days to come back. And
Okay.
we're not testing in the hospital, we're only testing patients if they're admitted. I
Okay.
don't know what.
It's changing on a daily basis. As of yesterday, we were doing drive-through testing. We have about, probably what, 20, I go through, every day we're getting an update of how many kits we have. We have 18 right now in Moose Lake. We were doing drive-through testing yesterday. Current recommendations from MDH now are to not do any testing unless someone is hospitalized or they're a healthcare worker. So we're reserving those tests now for the high risk, and I think we will be coordinating with Mercy about what is the appropriate site for those testing to be done. So we have tested, I don't know how many.
About a
sent out
dozen we've tested
that have been
since
sent
last
out.
week.
Turnaround time is about 5 to 6 days.
And that's
so-
for the COVID, it's not
That's
just for
correct.
flu?
No,
Okay.
that's for-
And those
Flu we
were-
can do right in the office.
Yeah.
But the issue that's coming down, Mike's already mentioned supplies, is viral transport medium and so on. The same swabs that we would use for COVID, we use for flu, we use for RSV, respiratory syncytial virus in our kids. And so looking at preserving our supplies and being cognizant of what do we need to know, what's going to change our management, what might we need in 2 weeks or 3 weeks or 2 months. And it's really hard to predict that. So yeah, we do have some testing capability here. We do not have any confirmed cases in the community.
I
I
hope
don't-
you can restate all that at the mic after. I want you guys to come up and, so we can get it all recorded. It's very good information. Is there anything else for Mercy from anyone? Thank you very much, I appreciate it. And Gateway, I'm sorry we don't have enough
Might move up.
mics.
Might move up
If you
here.
can pull ahead or up to the mic here if you're comfortable, whatever works for you.
So I'm Eric Nielsen and Dr. Camp from Gateway Clinic. Maybe first just an overview of operations and staffing. So besides Moose Lake, we have the Sandstone and Hinkley Clinic. Currently all 3 clinics are open. We have normal operations right now. Staffing is very similar. We're doing staff daily assessments, self-assessments. We've had 3 employees quarantined at home. One was actually tested, was negative. The other 2 was because of travel. So that same daily process started today. It was the first day of daily assessments for staff. The main change that we've implemented is just the patients we're seeing in the clinic. We're really only seeing acute patients that need to be seen. Any type of physical or wellness or preventive visit, we're delaying those or canceling those patients to be seen at a later date. We've moved to doing a lot of telephone encounters, a lot of these encounters that could be accomplished over the phone without the patient coming into the clinic. We are keeping those appointment times and actually meeting with the patient over the phone rather than in the clinic space. Staffing, we haven't done any type of reduction of staffing at this point. Our volume is probably about 30 to 40% of what we typically have in the clinic just because of the reduction in patients that don't need to be seen right now. Testing that we can maybe reiterate, so we've done about a dozen tests since last week. One was done in the office space because the patient wasn't forthright in the assessment when the patient came in. We later realized she was in Las Vegas the week before, had the symptoms, and was tested. That patient's results were negative. All the other tests we've done what we call the curbside testing. So the patient calls ahead, they're triaged, and only patients that meet criteria we were doing the testing for. And then the physician, the lab tech, and the nurse goes out to the parking lot and does the test through the car door window. It's a nasal swab test. We do an influenza test at the same time. If the influenza test comes back positive, there's no clinical reason to run the COVID-19 test. So that was a process we've been doing until this morning now with the FDA's recommendations to be more selective on screening. So we're not currently doing COVID-19 tests right now. As Dr. Kemp said, I think we actually have close to 30 tests available to do. We do expect to get more, so as MDH becomes hopefully more lenient on what patients should be tested, we might start doing testing again, but currently we're not. We're really encouraging patients to call the clinic. If they have symptoms, we're doing a lot of triaging over the phone. Best to keep the patients out of the clinic space for their sake and for the patients that come in after them. So that's a message you're really trying to get out to patients is if you have symptoms, as we're all seeing, it's best to stay home and self-quarantine. But if you have medical concerns, underlying conditions that are concerning, then you should be calling the clinic and we triage you over the phone. Some of the same supply issues, gowns in particular for PPE, we're short on hand sanitizer we're getting short on. Some of those orders are starting to come in, but they are back ordered. I mentioned the phone visits. We're looking into more telemedicine visits, so it's more of a televideo type conference appointment. Again, the emphasis keep the patient in their home. So we might expand into that beyond just doing telephone appointments. Non-essential vendors, we restricted all non-essential vendors from coming into the clinics, again, just to keep traffic at a minimum, what's really only needed. Special emphasis for patients who are over 60. Those are the patients that are more at risk, and trying to keep those patients out of the clinic space. Dr. Camp, what else? No students. We typically have a lot of nurse practitioner, physician assistant, medical students, residents in our clinics. And a lot of those school programs have discontinued anyhow, but those that hadn't, we have stopped allowing students in the clinic space. I think those are the key things. Do you have anything to add?
I have a question. How do you do the curbside check? Like if somebody calls up and they have the symptoms and contact you and you said, yeah, come in. How will that happen? Just so that we all understand how that goes.
We schedule it through our walk-in or urgent care clinic schedule. So that provider could be a physician assistant, nurse practitioner, or a physician. Depends on the day. So they would be scheduled over the phone, taking all the patient information over the phone, instructed not to come in. When they come into the parking lot, they're supposed to call back in, let us know that they're there. We then have a kind of a packet that goes out with the physician, the lab tech, and the nurse. The provider administers the nasal test, one in each nostril for the influenza and one for the COVID-19. And then some vitals are taken, I think O2 and breathing and temperature.
Temperature and oxygen saturation. That being said, I think that recommendation has changed, and so I don't know, and tomorrow it might change again. So right now, yesterday we were doing curbside testing and trying to coordinate those so we could again preserve our protective equipment. Had a couple that were back to back and so on. And now today the recommendation is not to be doing testing unless it's a high-risk patient or hospitalized. So.
And that usually takes like 48 hours now to get the response back.
3 to 4 days, 4 to 5 worst case scenario.
Yeah. 5 days, 5 to 6, depending on the volume.
If you're curious, the cost is $51, and it's actually not even billed through the clinic. It's billed from the lab agency. The LabCorp is a company that runs the test. And my understanding now is all insurances are covering that, but that's the fee. If you're curious, that's the cost the lab company charges the patient's insurance.
But just keep another question, Mike. Is the hospital doing anything like that too, like a drive-in test?
No, we're doing a test. As Dr. Camp said, if they're inpatient, they're tested. If they think, if they have the COVID symptoms.
I see.
So, yeah, and again, the tests are being used sparingly right now.
I see.
In an ideal situation, we would have unlimited testing that would help drive epidemiology, but we have to, just like we're all trying to conserve our resources, not knowing what this is gonna look like. So trying to follow recommendations.
That's why our statewide numbers are going up slowly. You're gonna see a little bit of an uptick as more tests are done.
I got one more. Does anybody have? I hate to always. Anybody?
Just
one more.
I know that we've,
Go ahead.
at the facility over there, quite a few staff that we've asked to self-quarantine for a period of 3 days and consult with the medical provider regarding return to work. So I know that we probably had an influx of employees that are reaching out, doing phone consultation and asking about return to work status. So it's I know that it's taxing on the healthcare system too, but it's kind of a moving target for us for employees to self-report symptoms, and then what do we do on our end to help protect not only our staff but our offender population too. So again, I'm appreciative of the extra type of medical consultation and whatnot that you're doing for our staff. And, ideally, we want everyone to return to work and continue on, but in the same sense, we need to be proactive in being safe with the employees and the better population. So, do you have like an online type of assessment that if an employee wanted to just type in symptomology and whatnot, that
We're trying to update our website today. We also are going to have a call-in, just a scripted phone line that people can call in and find out about COVID symptoms and what recommendations are. But as of right now, we do not have any online assessments or.
Yeah, the phone number for that hotline is set up. It's just a recorded message about information that will be updated regularly. If you want to record that number, it's 218-485-2014.
Could you give that again, please?
Yep, 218-485-2014. And it's not a line to leave a message. It's really a recorded message with current updates and suggestions for self-assessments for patients and which one should be calling in to get further triage when needed.
I actually had one other question on your staffing. If there's outbreaks in other areas, can your staff be pulled and moved to other areas? And, I mean, is that something that can happen?
Yeah.
And-
Yeah, we're looking at that. For example, our nurses, you know, could be
They could be
moved to
pulled and
med-surg,
moved,
yeah. And so the answer is yes, and that's part of the plan as things evolve, depending,
I see.
again, a lot of it's depending on patient activity.
Doctors also?
So thank you. I wanted to address that. I think it's really important here that you're going to do our as best as we can to take care of our community. There's a strong commitment from Gateway providers, from Mercy, nurses, and staff to do what's best for our community. And I think that's going to involve a lot of coordination. And we will be working together to take care of what we need to. I think that there's just a lot of uncertainty right now, and we don't know how this is going to play out. And social distancing, I keep hounding that because right now that to me is our best way of maintaining this at a reasonable level for our providers to do what they need to do to take care of our families and our community. But there's a very strong commitment from our doctors, from our nurses, our staff, and I know at Mercy as well to do what we need to do. And that's, I think, one of the joys of working and living in a small town is we all have that commitment to each other. So.
Good. Any other questions? Anybody? Appreciate that information, thank you. Police Department.
Thank you, everybody, for coming. I'm Mike McNulty. I'm the current interim chief of police. As the mayor said, our department is staying fully staffed and operational as normal. To include our administrative secretary, who's going to be there to take any influx of calls coming in, which we're going to start seeing. We've already started to see a few today. As far as the virus goes in our side of things, I've implemented protocols within the department as far as like with our squad cars. We've now got the sanitizers and masks, gloves, all the things that they need. Anytime we have anybody that comes into a squad car or is transported anywhere, the squad is getting disinfected, and they're going to go through the whole protocol and doing a thorough cleaning of the squad car. Our police department is not open to the public as far as internally in the building. The open entrance area where the medication drop off is going to remain open, but no one will be allowed beyond that point, except for the essential personnel. We are monitoring, obviously, the restaurants and everything in town, making sure that the governor's directives are staying complied with and that they're maintaining with that, and also dealing with any of the public that's having issues with those directives. So far it's gone very well. We've had one issue, but it was dealt with. Continuing to do the daily meetings with the city right now, and getting the daily updates and kind of adjusting like everybody else day to day. It is a rapidly changing thing, and we don't know how fast or how slow it's going to become here. This morning we started with our meeting, it was at 60. By noon, it changed and it was 77. It's changing rapidly. So, and then we will be, when we get some further information on stuff, we will also be putting any of that out for the public on our webpage and our Facebook page for the police department for the public to see as well. We are not doing any fingerprinting right now. I know a lot of your facilities, they have the nurses and stuff that have to get their license or whatever. We're not doing any fingerprinting right now until we get through this. that's gonna be shut down. As far as calls, we're gonna be doing as much as we can. If it's something that we can solve on the phone, we're gonna do it over phone and go make that actual contact. Obviously, in our line work, a lot of them, that's just not gonna be a possible thing to do. But if it's something that we can deal with over the phone, we're gonna do that just to eliminate that extra contact with public out there. When we are talking with people, our officers are gonna maintain the 6-foot distance when applicable to do so. And just try and bear through this just like everybody else is right now. See what tomorrow brings and get through it. Any other questions?
No, right now we are fully staffed, everyone is available, nobody's on
We
leave.
have no illness or sickness within the department right
That's
now,
good to hear.
or anything like that, so.
Thank you very much. Appreciate it. Jim? Chief? Fire Department?
The fire department, we have changed some of our response guidelines for all the medical calls where we won't have more than 2 people entering houses unless it's necessary. Dispatch is screening all callers to see if they show any of the symptoms and forewarning us if they are having any. See, our meetings and trainings are canceled unless we absolutely have to have them. But other than that, everything's still running as normal.
You have full personnel available and how many members do you have now,
We have
Jim?
25 right now.
25? And they're all, as everyone knows, a volunteer fire department, so the whole, I should say, region depends on your responses. That's why I kind of asked that question at some point, if it gets really critical for you and for the department, we need to make some real big decisions and stuff. One thing, because of the way your structure is, like on a response like medical, and if the chief and the assistant chief are there, I'm hoping that you guys have figured that out, that
Yeah,
one won't be there.
Yeah, we're trying to limit
Yeah,
exposure as much as we can.
yeah. We don't want to lose the whole
It all
number of
depends on what the call
management.
is.
Yeah, on one call. Yeah. If it comes to the point, which you and I probably need to meet again, we have to set up a command center in which we would coordinate, of course, with the 2 state facilities and with Mercy and everybody else. We'll have to, you and I should probably sit down and talk about that. And the command center would be at the Emergency Response Center, like we did during the flood incident. And that's going to be a little different situation because I think the facilities released you guys for a number of weeks, but this is a totally different situation, so probably the chief of police and officers are going to have to man the command center if we do that. Just information-wise, because I understand how you're going to need your staff also is kind of the resources, like you're talking about medical resources, that the human resources can become a situation too, and we'll have to coordinate well there and go from there. We'll have to draft Bob to come in because I heard you're retiring.
I am.
We may need your expertise. Any questions for Jim? Thanks. Are you done at the end of May or June?
If this keeps going, it could be another week, I don't know. No.
Yeah. Okay. So you could be drafted by the city for something.
There you
Remember
go.
that. Take that
Maybe I
note.
could be Katie's assistant.
There
How's
you
that?
go.
We're hiring.
Is there anything else from anybody that,
I have one more thing. I would
Yes,
start
sir.
tracking your time that you're putting towards this.
yes,
Because if it ever does go to get reimbursed, it needs to be tracked.
yes.
In a
definitely
proper
are.
form. I think it's a 214 form, I believe it is a FEMA 214 form.
Another thing that, for the city that I forgot to mention was that we discussed today about having weekly city council meetings that are not open to the public because we are trying to limit the.
Rogers.
Oh, we're trying to limit the number of people in the facility. That being said, they will more than likely be recorded and put on the cable TV channel as well as YouTube. So,
And we will state at the beginning of those meetings that the public can call in with questions. We won't answer them during the meeting, but we will get back to them and answer any questions to anybody in the community or whatever on what's going on. For the newspaper, I hope you can make it to some of them. If you come weekly, I know you probably have a lot of things going on that you may not be able to. But we hope to keep the numbers down to that 10 numbers as advised. If we're gonna do this, we should follow it to the letter, so we're gonna try to do that. I know it's hard on a meeting like this, and just for information, if some didn't hear, tomorrow we're having another one at 10 a.m. and we're going to meet with financial institutes in town, the grocery store, the drugstore. They weren't going to make it. Chamber. And we'd like to share the minutes that we took here with them so they know how you're operating. And the minutes we get from that meeting, we'll share with all of you so you know how they're operating also, which hopefully will benefit everyone in the community. With that, is there anything else?
well, I guess the burning question is whether we want to continue having these meetings weekly. Would that be beneficial for everybody? I'm more than happy to continue to do them. I just want to make sure that everybody else is willing to attend.
I'd come next week.
Would you?
I would.
Please.
I'm kind of in the every other week camp, just because everything's
Sure.
moving and we've got umpteen other groups that we're.
Why don't we do this? Let's, we had this week. Let's see how things go next week. If there's a lot of changes and a lot of things going on, maybe the week after, we'll plan a meeting or see if it's available for everybody, and we'll plan it like that and see if we can get together again.
We could also give you regular updates too.
Yep.
So.
Another
Things
thing
change.
is, did everybody sign that sign-in sheet? Because then I will have everybody's email address. It's probably, email is probably the best way to communicate right now, because I don't think anyone's sitting by their phones. I think they're in meetings by the sounds of it.
Yeah. And everybody may get, which, when you think of everybody here, you're probably gonna be in meeting after meeting after meeting. And as an ex-federal employee, I know how that goes. You can get overwhelmed with meetings, and we don't want to add to that problem. Everybody will have enough on their plate, so.
Some of us will be on the front lines.
Yes, yes, and it will
Hopefully
be
not.
very hard. So we'll do it that way. This was very, very informative, and we'll see how next week goes, and then we'll call to see if it's something that will work for everyone, or worthwhile.
If there's anything that happens to drastically change or come up within any of the facilities or at the hospital or the clinic, please call, give me an update on it, and just let me know via phone or whatever between now and the next meeting we have, so we can stay on top of it, so we can get things done for you guys correctly.
Very good. Thank everyone for coming. Appreciate it.
Yeah, thank you.
Have a good evening.
Thank you all for your work.